The road to herd immunity is starting to be a little bit bumpy. Republican lawmakers and the Evers administration are pointing fingers over the slow rollout of the COVID-19 vaccine in Wisconsin. Fox 6 investigator Brian Polson shows you the choke points that have Wisconsin lagging behind some other states.
If you ask state health officials about COVID-19 vaccine distribution,
how is the rollout going so far?
They'll tell you they've made incredible progress.
Well, I think we're really hitting our stride.
Wisconsin Republicans have a different take.
That's just unacceptable.
That's unacceptable.
This is absolutely unacceptable.
When Governor Evers delivered his annual State of the State address Tuesday night,
we're working to distribute the vaccine doses as quickly and as fairly as we can.
He used the word vaccine just twice.
There seems to be no sense of urgency with the Evers administration.
But Assembly Speaker Robin Vos made the vaccine rollout a highlight of his response.
Wisconsin is an embarrassment compared to other states.
Data from the CDC shows Wisconsin is lagging behind other states in vaccine administration, 41st in the nation as of Friday afternoon.
Are we using, as fast as we get the vaccines from the federal government, are we getting them into the arms of the public?
On Thursday, the State Assembly's Health Committee peppered a DHS executive for an explanation.
I want to be clear that that supply chain is not within Wisconsin's control, right? What we receive on a week-to-week basis is an allocation from the federal government.
Assistant Deputy Secretary Lisa Olson told lawmakers they're only getting 70,000 doses a week from Washington, a per capita rate that's 47th in the country.
It's the number of doses coming into the state.
And Deputy DHS Secretary Julie Willems-Van Dyke says once the vaccine is here, they still have to get it to the right people.
This is a really complex process, and I think we've done an incredible job.
But State Assemblyman Joe Sanfilippo says that's where the system is bogging down.
I have been contacted by vaccinators telling me that we have vaccine on the shelf ready to go, but we've gone through all the approved people so far, and we can't get any answers from DHS as to if we can continue vaccinating.
That's because the state still hasn't decided who should be vaccinated next.
The rollout has not gone real smoothly.
Last week, a state vaccine subcommittee put out a Phase 1B plan for public comment. This week, it comes back to the subcommittee, which sends it on to the full committee, which eventually sends it on to the governor for final approval.
By the time we agree on who's going to be in Group 1B, the rest of the country is going to have passed this up.
The federal government gave us guidelines. I think they're very reasonable.
Senator Alberta Darling says the whole exercise is unnecessary since federal guidelines for each phase already exist.
They are duplicating the list that the federal government put out.
While Republicans and the Evers administration point fingers, millions of Wisconsin residents are still wondering when they will get a vaccine. And if there's one thing everyone agrees on,
We share your interests in getting vaccines into arms as quickly as possible.
time is of the essence.
This is too important of an issue. People's lives are at stake. We should be focused on one thing and one thing only, getting as many people immunized as fast as possible.
Brian Polson, Fox 6 Investigators.